Good afternoon, and welcome to Mothers Outreach Network's exciting lunch and conversation. I'm Esther Coleman, the board chair of Mothers Outreach Network's Board of Directors, and today we're here to explore something groundbreaking: the push for guaranteed income and Mothers Outreach Network's transformative Mother Up project. I am a practicing attorney in DC and Maryland and started working with Mothers Outreach Network as a volunteer, joining the board sometime thereafter. When I first met Melody, she was speaking about Mothers Outreach Network at a meeting of the Greater Washington Area chapter of the Women Lawyers Division of the National Bar Association. At that time, I was looking for something that I could be civically engaged in and also use my skills as an attorney. I started off helping with brief legal clinics where we discussed such topics as Ban the Box, which is now law in DC, restricting employers from asking about criminal history, to discussing matters of child custody and child support to a group of young fathers. I am so proud to see how much the organization has expanded and increased its impact in the community, and applaud all of the hard work of Melody and the staff. I would also like to thank our foundation partners: Greater Washington Community Foundation, W.K. Kellogg Foundation, Meyer Foundation, DC Bar Foundation, Whitman Walker Legal Services, and today's sponsor, Eversheds Sutherland. We're thrilled to share insights into our Mother Up Guaranteed Income Research Pilot, a unique effort dedicated to supporting mothers engaged in the child welfare system right here in Washington, D.C. This program directly tackles poverty-driven, forcible separation of children from their families, a crisis that overwhelmingly impacts Black families in our communities. Join us as we dive into the inspiring early lessons from this initiative with our partners in research and justice, Dr. Jim Greiner and Mandy Mobley Lee from Harvard Law School's Access to Justice Lab, alongside our founder and executive director, Melody Webb. We'll uncover the potential of guaranteed income to create stability, empowerment, and lasting family unity. Get ready to be part of a conversation that's sparking hope, progress, and transformation. I also would like to introduce you to the moderator of today's conversation, Kristen Weber. Kristen Weber is the Senior Director of Child Welfare at the National Center for Youth Law, where she leads the organization's efforts to transform and build alternatives to child welfare systems. Kristen coordinates policy, litigation, and communication strategies to support safer, healthy, and thriving communities in an effort to prevent the trauma of family separation. She is particularly interested in stopping state actors from weaponizing the child welfare system into the surveillance and punishment of Black, Indigenous, and LGBTQ+ children and youth, and creating strategies that increase justice and liberation for children and youth. The predominant focus of her career has been on identifying and addressing racial and social inequities in the child welfare system. Kristen designed and led a multi-year, multi-jurisdiction qualitative review project utilizing an institutional analysis methodology to analyze laws, policies, and practices that contribute to poor outcomes for populations involved with child welfare systems. She has written accompanying reports about child welfare system contributors to racial disproportionality and disparities experienced by Black and Latino children, youth, and families, systems responses to survivors of intimate partner violence and their children, and system contributors to the lack of safety and affirmation experienced by LGBTQIA+ youth and families. In 2020, she helped create and launch the Upend movement, an effort focused on abolishing the current child welfare system and building many different alternatives that will support the safety, care, and healing of children and youth. When not at work, Kristen is engaged in local politics, more recently interviewing city council and school board candidates. She and her partner also spend most of their weekend time with their 2 kids at an orchestra concert or a sporting event. Welcome, Kristen Weber.
Hello, everyone. I hope you're as excited as I am for this panel discussion today. In true hybrid form, we have two panelists with us in the room here in Washington, D.C., and one virtually. For those in the room, he's like hovering above our heads, right? Just to give the sense. So I'm just going to begin with a quick introduction of everyone, and I'll give you a little bit of a sense of what we're going to talk about today. It's going to be a fast discussion, and I hope a very rich discussion for everyone. So we have Melody Webb, and Melody is the founder and executive director and CEO of Mothers Outreach Network. We have Dr. Jim Greiner, for those of us above us, but also here to the side. And he is the faculty director of the Access to Justice Lab. He holds the S. William Green Chair at Harvard Law School and is a former Department of Justice litigator. And next to me is Mandy Mobley Lee, and she is the assistant director at the Access to Justice Lab at Harvard Law School. So just a couple of things. Both Jim and Mandy are researchers. And for those of you who know Melody, she is an amazing advocate. So we're going to have a discussion that you'll hear a mix of research kind of language, but also advocacy language. And sometimes that language is very different. For example, when we talk about child welfare systems, oftentimes advocates will talk about child welfare systems as family regulation or family policing systems, following more in how parents and youth describe this system as opposed to its more traditional language of child welfare. The other thing I want to mention is for folks in the room, you have index cards on your table, and we would love to receive any questions you have. I can't promise we're going to get to them, but if we can, we would love to. And for folks on Zoom, please drop your questions in chat. They'll be monitored. And whatever questions we don't get to will be reviewed for future programming purposes. So with that, let's dive in. Okay. So the very first question is more of a, an introduction question for us all. Can you begin by telling us about your organizations, the goals, missions of your organization? And Melody, I'll begin with you.
Absolutely. And as you've stated, Mothers Outreach Network is an advocacy organization, and our organization is concerned with keeping families together. We have a particular focus on Black families who are disproportionately impacted by family regulation and policing. And what we do is we confront harmful government income and family regulation laws, policies, and practices in an attempt to transform them from harmful to supportive. And I wanted to say really quickly that we have here in Washington, D.C., I said I'd share some really quick stats. 13% of the population lives below the poverty level. And just a really quick myth buster that the primary composition of the abuse and neglect cases in DC are neglect cases, 90% of them. And our work, again, is concerned with addressing the fact that poverty is often misconstrued as neglect. So very quickly, I want to go through the outlets that we use to confront these harmful systems. We have legal program, policy program, organizing and outreach, and research. Our legal program, of which we're very proud, and we have some pro bono supporters here. We have an early defense program, which attempts to address the issue that parents, when they're investigated and up through a snatching of their children by the government, they actually do not have a right to counsel. So we provide representation in those cases. We also engage in child protection register expungement work, which is, again, really critical because in these cases, parents risk having their names on a register permanently. And again, they don't have a right to counsel in those circumstances. We additionally work on tax credits and advising parents of their rights with regard to accessing low-income parents focused child tax credits. And policy-wise, we have been leading proudly with some of the people in this room, the DC Guaranteed Income Coalition, and our work has been amazingly successful in bringing about the creation of a local child tax credit here in DC. Moreover, there's been work around benefits, cliff mitigation. Our work, we're very proud of that, to have people in the room have assisted. Our organizing strategies are also pretty incredible, I have to say. We work with community advisory boards, we create them. There are members here in the room who've been a part of them. And we also work to empower moms. We've got a number of moms in the room and are so proud of them. Our advocacy training is also a part of that work. And then finally, we're so pleased to have the partnership of the Access to Justice Lab, which is enabling us to really delve into the space of research. And the pilot was motivated by the data that I shared. Those of us who work in this space know that poverty is unfortunately conflated with neglect. And we as advocates know this, and we wanted to engage with researchers who would help us gather the data and evidence to support what we believe in this way. So I'm just really proud to be here.
Mandy, why don't you go next?
Sure. Thank you, Kristen. And Melody, we are equally excited to be partnered with the Mothers Outreach Network. So I am Mandy Mobley Lee, and I'm with the Access to Justice Lab. It is a research center within Harvard Law School, and we are dedicated to transforming the legal profession into an evidence-based field. We use empirical research to improve the justice system and make it work better for everyone. We run randomized control trials, or RCTs, and our RCTs generate credible and rigorous evidence that lawyers, judges, and agency administrators can use to improve access to justice for families and individuals.
So Jim, we're going to turn to you, and there's got to be a story here, right? How did you, Harvard and Melody, come to work together?
It is a family-centered story. In fact, I did not know Melody until about a year after I knew Melody's son, Philip. When we hired Philip out of a quantitative degree that he had received from the University of Chicago as a data analyst, and he spent a year with us. Unfortunately, I only met him twice because it was the pandemic year. But nevertheless, we were able to communicate and work together very effectively. And Philip introduced me to Mom, who happens to be sitting on the stage. And Melody, it's always been a pleasure. And we have pursued a partnership since then to try to generate objective and credible evidence regarding the effect of guaranteed income in this setting. As you'll hear, we are currently pursuing what I characterize as the pre-pilot because the number of individuals in the program will be too small for us to draw rigorous and credible information. Nevertheless, we can draw some conclusions, and most importantly, we have conducted a strong field test in order to pursue a larger operation that we hope to pursue in the future. So we are again delighted to be involved in this panel.
I'm just checking in with Melody. Do you have any more to add to that?
No, typically it's the parent who introduces the child to. In this case, it was the reverse, and I'm so proud of Philip. He actually wants a finder's fee, but I.
Well, so Melody, you took us through pretty quickly Mothers Outreach Network and what you're implementing for families. And I'm wondering if you could just talk a little bit more about that and why it's so important.
So it's incredibly important because as I mentioned, the majority of the families, the overwhelming majority of the families in DC who are involved in this system are living in poverty. And in fact, that's the makeup of families across the country who are involved in the system. So what we're doing is we are providing $500 a month to women in our guaranteed income pilot, which is again being evaluated by Access to Justice Lab. And I want to just tell you a little bit about some of the criteria. So the moms have reached their current involvement with CFSA, which is the name of our local CPS agency here. And I just want to highlight that this is not to treat people who are in a diversion stage. They have not been screened out. There are people who are currently involved or recently involved, and that's intentional because we want to test impacts and really expose what happens when people are entangled in the system, but the children are still in the home. The money that we're providing has no strings attached. So unlike when they're involved with CPS agencies, they're not required to take part in parenting classes. Unlike when they're receiving assistance from the government in the form of TANF cash assistance, There's no work requirement. There's no administrative burdens at all placed upon the parents. And we're doing this work in the context of our broader advocacy, as I mentioned before, child tax credit advocacy, which when it's fully refundable, means that even people who have no income can receive those payments, can receive a tax refund. And if they have no earned income, that is. And tax credits in this way deliver benefits, and tax credits have become our model for how to deliver guaranteed income. There's a lot of benefits to the tax code as a way to give people this no strings attached, no wage earnings required, and the tax code is one of the best. A lot of us know, like the earned income tax credit, for example, is considered to be one of the biggest poverty reducing programs in the country. And, you know, I think in particular in this context, it's valuable. I think Dorothy Roberts talks about dignified entitlements, and tax benefits are something that we all believe are things that what we're entitled to. So in that way, we're really excited about using the tax code as a model for bringing about guaranteed income.
Great. So I don't know about you all in the room, but I hear like terms like guaranteed income, supplemental income, universal basic income, right? So we're hearing all these terms. So Mandy, I'm going to look to you to help us understand what is meant by guaranteed income here in this program, Mother Up.
Sure. So guaranteed income in its basic form is a series of unrestricted cash transfers, and unrestricted meaning there's no strings attached. So guaranteed income recipients will receive their cash transfers with no hoops to jump through. So in that way, guaranteed income is like universal basic income. However, UBI programs are designed to provide minimum income to all people, whereas guaranteed income programs provide supplemental income to target groups of people. So unlike UBI programs, guaranteed income programs are specifically designed and targeted to address social issues and help marginalized communities escape poverty, reduce social inequalities, and promote equity. So Mother Up, in Mother Up, what they are doing is they are targeting a specific group and a specific social issue that is more than just poverty. Some guaranteed income programs have provided cash transfers to families to pay for basic needs like housing, transportation, healthcare. But Mother's Outreach Network is doing something a little different with the Mother Up program. Mother Up pilot participants are given the freedom to choose how to spend their unconditional cash transfers. And the Mother Up unconditional cash transfers are being provided by a private nonprofit organization that is not affiliated with a child welfare agency. And so in this way, Mother's Outreach Network is building mutual trust with their pilot participants.
So let's get into some more details about Mother Up. Can you talk to us a little bit about recruitment, other details that you want us to know about how you've been going with this pilot so far?
Sure. I also want to point out, I'll start with just this, that one way that this pilot has been, is particularly challenging, as Mandy has just described. There are a number of different guaranteed income pilots, is that we're dealing with a lot of racial tropes about Black women, and just by the nature of what we're doing, we are really, unfortunately, working in a space where many people consider our pilot participants to be the most unsympathetic. And for that reason, narrative change work is very important. And so we're really committed to sharing stories and having our moms speak out about their experiences. With regard to our implementation, we've been really, really pleased to be, the implementation partners of the Access to Justice Lab. And that means that we have been, with the help of just a wonderful group of wonderful staff, conducting enormous amounts of research, recruitment, including since 2022. I mean, we've really been at this for quite some time. We do operate another pilot that's a small soft launch pilot, and it started last year. 5 wonderful moms, a couple of whom are in the room today. That predated the current research program. So it's all started really with a mutual aid survey. One of our moms actually walked around the community and accepted responses to a survey that we put together. We ended up setting up a virtual community tax clinic with one of our sponsor partner here because we heard so much about myths people had about the 2021 tax credit that they were eligible for, and they didn't realize they were. And so just, moving forward, what you'll notice is that we're really a grassroots community-based organization that listens to our members. So the recruitment process really folded in a lot of the work we were already doing. And we started, as I said, the smaller pilot a year ago for moms being in for 3 years. And we formed partnerships in the community with organizations, some of whom were contracted service providers of Child and Family Services Agency. We did a lot of flyering at community events, but I want to talk to you about the challenges that we encountered, and they were substantial. With these contracted service providers, as well-meaning as those organizations are, essentially, when the time came for them to make referrals to us, we saw a lot of reticence to refer, and we don't know why that was. Our assumption is that there was a concern about reprisals for participating because we had done some outreach to the agency and really had a lot of hard time getting positive response from them. We missed some funding opportunities because of some of the steps that we really needed the agency to assist us with, specifically regarding verifying eligibility. We also did encounter some concerns from moms who were afraid that in the process of us, for example, trying to verify their eligibility, that the agency social workers would come to learn about it and then might in some way retaliate against them. That was, of course, very disappointing to hear, but in some ways sort of representative of, sort of the harmful contacts that parents unfortunately have with this agency. And I will say that some of the protracted difficulties we had did lead us to lose a substantial amount of funding because of the delays in implementation of the project that resulted from this. So those are some of the activities we kind of engaged in.
Great, great. So this is bizarre, but we are way ahead of schedule. So I'm going to encourage us to stretch it out a little bit in terms of, because we want to make sure we say all the things that we wanted to say. So I want to go backwards just a little bit to something you said earlier, Melody, that you said very quickly around the need for narrative change. And can you just sort of talk us through what you've learned and why?
So there is, you mean in terms of people's
The tropes.
Yes, the tropes. Black women, Black families are disproportionately involved in the system. I think the stat is something like 53% by the time, Black families with children turn 18, they will have experienced an investigation, CPS investigation. There is rampant misidentification of poverty with neglect. Lots of conversation, about the way that, Black parents speak and the way that Black mothers are just generally perceived in society. I think we've all heard these about laziness and all these other harmful stereotypes. And so and just again, a question about whether people are deserving. of assistance. What we have been doing, again, through our Moms Empowerment activities is we have been showcasing the leadership. We were talking before the program began about how moms are really showing up to advocate at our local city council. We've got a star mom who's going to speak later, who's actually delivered a briefing, participated in a briefing on Capitol Hill to members of Congress. So, we are in that way. Moms are showing up, moms are providing peer support to one another. And so we are through social media and trying to get our storytelling out there and really just lifting up moms themselves as a way to counter those negative narratives.
Thanks. So we're going to turn a little bit to the research, but we may come back to this. And I also encourage folks to go ahead and start thinking of your questions. We have folks who are going to be collecting the questions in the room, and again, somebody's monitoring the chat. So Jim, tell us about the research methodology and why did you measure what you measured, and how did you all work together to sort out measurement and evaluation?
Happy to do it. First of all, I just wanted to apologize for not being in the room with you today. Only a little bit of a health scare could have kept me from traveling for this event. I'm 100% fine, but that is why I'm not with you. The research methodology deploys what the Access to Justice Lab uses day to day, which is a randomized control trial. And what that means is that some participants in the research will experience the system and their family situation as though there had been no research, with one minor exception, which is that they have the opportunity to participate in surveys and in semi-structured interviews and receive compensation for that participation. And so we call folks in that group the compensated research group. This is a terminology that came from the Community Advisory Board, which I'll be talking about in just a moment. Then a second group is the direct cash transfers group, which experiences everything that the compensated research group experiences, but in addition receives the $500 a month payments from MON, not from the Access to Justice Lab, but from MON. What we do at the Access to Justice Lab is we then follow up with everyone for the folks that are in the direct cash transfers group who are receiving the funding. We, with their permission, all of this is with informed consent, take a look at the vendors, the dates, and the times for the expenditures of the funds. And this is and we're going to be deliberately using research terms here, not advocacy terms, assessing the myth that folks will misuse money. We hypothesize that they will not, that they will use money on things that one would want them to, the funders would want them to use them money for. And so we can check that by seeing the vendor and the dates and the times of the expenditures. We also, again, with permission, conduct surveys. And in the surveys, we ask questions about financial stability, employment security, housing security, the physical and mental health of parents, and the parent-child, the strength of the parent-child relationship. These are, as well as some attitudes, these are all using validated survey instruments. These are not things that we came up with on our own. These are things that other psychometricians have validated thoroughly. The semi-structured interviews are typically about 45 minutes to an hour long. The person who conducts them for the Access to Justice Lab is in the room, Alina Shanu, she's in the audience. They are designed to allow for more qualitative information. Randomized studies do an excellent job of telling you exactly what is going on. They do an unparalleled job for that, but they do not tell you why what you observe is happening. And that is where the qualitative information comes in. And so we again do this with all of the participants, both those receiving direct cash transfers and those receiving in the compensated research group, not obviously the vendor and payment information in the compensated research group, but everything else is the same, so that we can create, with a randomization process, a rigorous comparison and find out what the effect of the cash is, because that's the only relevant difference between the two groups. I should say one other thing, which is why would MON or why would a research program like this want to involve researchers at a law school and that know things about law? And again, using research language here, we found startling to us similarities between the child welfare system and the criminal justice system, which is where we do an awful lot of our work. Again, using researchers' terminology, we take no position on whether those similarities are a good thing or a bad thing. But the fact that they are there makes it useful for people who know their ways around courtrooms to be involved in this sort of research, because the child welfare system does frequently involve the courtroom. And so there are a lot of research shops out there that know how to count. We also know how to count. We have folks that we spend a lot of time doing that. And I spent 5 years in a PhD program learning how to count most thoroughly. But there are a lot of folks out there that know how to do that. And what we try to do is make sure that the legal angles are thoroughly covered. And again, they are present in ways that I, as someone new to this area, found surprising. And so that is the research methodology.
Well, thanks, Jim. Mandy, I'm going to turn to you. I think this is like the question that the room wants to know, maybe, but what have we learned so far?
It's a great question. So I will level set and say that it is right now too early for findings, but we have learned a few things about running a guaranteed income program that is targeted to this group of people. For example, as Melody alluded to earlier, eligibility determinations that are based upon recent or current involvement with the agency can be challenging. Often, mothers do not have documentation of their investigations, and requests to substantiate those investigations and their involvement could take several weeks and could go unanswered. Another thing we also learned is that mothers are very eager to participate in Mother Up, regardless of which group they've been randomized to. Both the direct cash transfer group as well as the compensated research group are dedicating their time and spending their time answering surveys and interview questions because they believe in the research and the Mother Up program. So as researchers, we're very encouraged by this, and we are looking forward to the results.
All right, Melody, the advocate.
I don't think I'd ever heard you say that in that way. That's really great. And one thing we try to do is we offer optional programming. So in addition to participating in the research project, they can also, we offer them opportunities to take part in our Moms Empower, peer support, and advocacy training program. We also allow them, of course, the opportunity to take part in our legal program. And we actually have discovered that there are a number of legal issues that are sort of dogging these moms either at the outset of their participation in the program or during the course of it. So to some extent, we've become sort of their general counsel, and we really do support them. And we're really grateful for the support of organizations like the DC Bar Foundation, because without our legal funding and legal programming, it'd be very difficult. And our observation is that people also experience interruptions in their benefits. And so we are, and particularly with regard to housing, we see lots of questions around housing, and we try to accommodate all of the legal problems that are encountered. And I think, these are the kinds of economic hardships that parents are facing that result from how difficult it is administratively to access cash assistance and other types of benefits assistance. So again, we're, just learning a lot even on our end programmatically as well.
Well, and Melody, you have such a strong vision and set of goals for this program. How was it working with evaluators in this mixed method kind of way to capture your vision?
I mean, I think they're doing a great job. I think the qualitative approach in particular, as I mentioned earlier, storytelling is important, and we are on a parallel track doing everything we can to share the stories of the moms in our program. You know, and I just want to say, like, we are really, really keen to show that, you know, financial distress can cause any and all of us problems. And we want to, you know, really highlight how it manifests in the way that the moms in our program see that in their parenting. I mean, financial distress really ought to be kind of understandable to all of us, you know, given that at this point in time, about a third of our country is ready to trade our democracy for what they believe will be lower costs of eggs. So, I mean, I think we all can imagine that from day to day, as people are struggling to keep bread on the table and to make sure they don't have to choose between their children in order to, you know, buy them shoes or other necessities, that there are challenges. And so we are very concerned with, and think this project is capturing, you know, how people navigate being a parent and also handling, you know, those issues. So we were particularly interested in how people handle stress and levels and parent effectively. You know, we want to make sure that people get to measure how effective they are as parents, because we know that they care about it. We know that they want to, like all parents, feel loving and caring and able to meet their children's basic needs in a manner that comports with dignity. So we absolutely believe that this pilot is capturing all of that.
So I have one more question, and then I'm going to turn to audience questions. And the last question is for you, Melody, again. Just on a systemic level, what have you learned so far? What are your 3-4 biggest takeaways?
So the government, through these systems, and they're not just the child welfare agencies, they're through the courts with lawyers and judges, are really rendering very harmful impacts on families, families who are struggling with poverty. And we have a great deal of money in this country. We are the wealthiest and most powerful nation in human history, and we can address these problems. In Washington, D.C., for example, there is actually a flex fund that is regularly underspent by our local child welfare agency, meaning that there's money appropriated to meet basic needs, and our government is not spending all of that fund, if you can believe it. The agency itself, there's over $220 million spent on the agency services, contracted services, staff, and that money could be going directly to parents, and it is not. So, you know, that is, you know, government can do better. I just want to say that our program is external to government. It's independent, but it is meant to inform government policy. Just want to be very clear about that. And then I guess, and I do want to say that there is a version of a child tax credit. We're so happy that the more modest version passed, but it needs to expand. We could fund for 8 or 9 years a child tax credit with that $220 million that's funding the agency. So we want to see that happen. I also want to say that, you know, moms who I've become so close to, some of them in this room, are just like me. You know, I'm a mom. I was so fortunate to be at home with my kids for many years. And I just want to say that when your children's, you know, basic needs are met, when your basic needs are met, you are freer to think and dream and love and just, you know, be there for your kids. And I think that should resonate with all of us. When you're not worrying about paying your bills, you can sit and your kids can climb all over you, and you can just have, you know, joyful times with them. And I do want to say, because there's been some really unfavorable press about a publicly funded guaranteed income program in DC that we also fought for. And that program, you know, has been written up in the press in a really unfavorable way, because there was this focus on some parents' decision to spend their cash on trips with their children. It is time for us to acknowledge that having joyful times with your kids is just as important as anything else. So when we free, so when we meet basic needs for families, you know, we will see moms doing all these great things and actually asking for more support. We are right now, in fact, looking for someone who can provide yoga instruction and, you know, just do some more social work support that is parent-centered and not punitive and not carceral, because our parents are asking for that now, that they're feeling a little bit more financially secure, and that's a good thing, right? So we're just really excited about hopefully a model that we're building and what the research we believe will show. And we're just, you know, hoping that we'll move in the direction of that, you know, these policies I've espoused have described.
That's great. So we're going to move to questions from the audience. I encourage you to keep them coming, both virtually through the chat and also in the room. And I want to start with Jim or Mandy, just to talk to us about where is the research going? How is it going to be disseminated? Like, what is the timeline? That kind of stuff.
Jim, would
Mandy,
you like to start this?
Yeah, I could talk about the general direction of the research. We will be delighted to produce and talk as much as we can, given the limited number of participants in the study. The pre-pilot is what I've called it, and so that will mean compiling the qualitative information received via this we receive via the study, the interviews, the post enrollment interviews, as well as the quantitative information that we receive from the surveys and from the examination of the spending habits, as well as information that we anticipate and very much hope that we can receive from the court system and the agencies regarding post-enrollment agency and court involvement, because I think everyone's hope is that that MONS program will be effective in minimizing that involvement going forward. I think that's the hope of the agencies and the court system as well as MON. And we will be delighted to talk about those in as many settings. The major danger that folks will face is telling us when to shut up. Because when you ask researchers about their research, you better be ready to tell us when to shut up or we will not. As far as the timeline goes, Mandy, I'll leave that to you with one quick comment beforehand, and that's that I neglected to mention the importance and the centrality of the Community Advisory Board and all that we have done together with MON, and the fact that our conversations with MON are what produced the areas of follow-up for the study. With the Community Advisory Board, with the Mothers Outreach Network, we came up with the areas that we were hoping to study, and then our job as researchers was to go find validated survey instruments that would effectively collect the information. But as far as what we were collecting, what topics we were covering, that came from the Community Advisory Board and from MON, as did a lot of the terminology that we use in this study. And so again, Mandy, why don't I turn it over to you for timelines and further comments?
So before we do that, Jim, I just was handed a note that I think is a follow-up to what you were saying, which is what are the outcomes you all are measuring in the research study?
Absolutely. So with the surveys, we are measuring things like self-reported strength of the parent-child relationship through an instrument called the PFS2, the Protective Factor Survey 2. Financial stability and security through a CFPB created survey that has been validated and used in various places around the country. Employment security through questions that come from the CFS, the Community Family Survey, as well as other surveys that the Census Bureau runs. With intense frustration, I have found over and over again that there is no validated survey instrument to measure housing security, which is a frequent outcome that we would like to measure in our studies. Generally, we believe that legal interventions, that for the follow-up of legal interventions, assessment of legal interventions should not stop at courthouse steps. And certainly this intervention aspires to go beyond courthouse steps. And housing security is something that we would like to measure rigorously. Right now, we are left with coming up with our own questions. And then in the qualitative portion of the interviews, we ask moms for their stories. And we try to record those as faithfully as we can and compare the narratives that we are able to see as we do with the survey instrumentation, as between moms in the direct cash transfers group and moms in the compensated research group. Again, because of the randomization process, there is no difference in these two groups other than the cash. The services that MON offers are available to all participants in the surveys. And so all participants receive more than they would have received had they not participated in the program. And some get the cash and some do not. And so what we can do with the randomization is draw very sharp causation inferences based on the cash when we have enough observations. This pre-pilot will not produce enough observations, but we hope that a follow-up study will do so.
That's a good segue into the timeline. So as Melody mentioned, Mothers Outreach Network started with a soft launch. And then the Access to Justice Lab was brought in for phase 2, which is ongoing. And then phase 3, as Jim mentioned, would be a follow-on study with a much larger participant pool. And we are looking at continuing our partnership on that phase.
Which is great.
I have so many research questions that just came, I have to say, and I love them all. They're great.
Jim warned you.
No, so I have a couple of worries around the research, I guess. So I'm gonna read them both, and then you and Jim can figure it out who wants to take them. And I think Melody, you probably have thoughts on this as well.
Mm.
So one of the worries and one of the questions, I'm just reading word for word, are you worried that the research will be used by CPS so that they can run a GI program? Can the research do anything to address this? So that's one worry. Another one is framing the research around whether or not mothers would, quote, misuse the $500 guaranteed income seems in and of itself rooted in racism / anti-poverty bias. Is there a way, are there research questions outside of this that don't further these biases, or are they so entrenched in public consciousness that it's not possible? So two very different worries, right? But one is sort of about the co-opting maybe of CPS and nesting it within government, and also then this piece about, you know, how the research is being used, and is it, this is my words, right? But is it confined by larger biases?
Can I just say one thing? So there was an attempt to co-opt this project and we resisted it. And the reason that it took us so long to both get, access to records, which it's still not clear we have all that we need. And also we lost a year's worth of funding for 12 women is because the process was protracted. We refused to allow the agency to co-design with us. So we are resisting that and we do not plan to cede. So I just wanted to say that that's like a factual piece. And I'll just go ahead and defer to you.
Sure. So as researchers, our goal is to generate research and evidence that can be relied upon and replicated. So if someone takes the research and creates their own program, that's a good thing. However, to Melody's point, if it was a government agency that wanted to replicate it, it would generate most likely different results because, as I mentioned earlier, Mothers Outreach Network is a private nonprofit organization that's not affiliated. And so there is that mutual trust that's been built with participants, which may or may not exist with a government-run program.
And to the second question, Esther, about the structural racism built into the question about whether there is misuse of funds. There are certain questions that we feel like we need to answer simply because they are asked, and they are asked by people who might have control over funding. opportunities, and they are asked by people who are in this, consumers of this type of research generally. We will not ask any question that that folks want answered. We will take some view as to whether questions are appropriate, but we try to be as encompassing as possible. And if there are structural questions that could prevent future implementation of the intervention that we are evaluating, we try to take those very seriously. We certainly are measuring a great many other outcomes. So quote unquote misuse, or maybe the better way to simply say it is use of the funds. Maybe that would just simply be a better way, in which case that's my mistake, is something that is a part of the narrative of guaranteed income programs generally. But it is by no means the only outcome that we would find relevant or that we are measuring. And I've listed a good many of them. And so we, again, try to be as all-encompassing as we can in order to produce useful information that would be useful for generalization of the type of intervention that we are involved in evaluating.
And I just want to point out that there have been over 100 guaranteed income pilots implemented across the country, including some here, Thrive East of the River, and others in Washington, D.C. And what they have found overwhelmingly, Jim, I don't know your use of the word misuse, is that parents spend the money, people spend the money on their basic needs. And in fact, people work more when they get extra cash, not less. So I just want to clarify that. And also, the reason I talked about parents having a right to use the money for joyful activities with their children is because we absolutely believe that the ways in which parents are using their money are legitimate. We believe in parent agency. So unearthing how parents use their money, we are there as advocates to champion and support that and to try to change narratives about anything being a misuse of money, because we believe in parents having the liberty and ability to decide what's best for themselves and their family. So I think it is important for us to be attentive to what parents are saying in response to surveys so that we can then create, broaden and the permission structure for parents, regardless of their income and their race, to be able to do what any other parent might do with extra cash.
So Melody, I'm going to go a little bit back to
Mhm.
when you were talking about not co-designing with CPS, because I think it may have something to do with this question, which is, I've noticed a few GI programs have been drawn into question through litigation around the country. Have there been any pushback or attempts by individuals or people in concert to impede your efforts? If so, why do you think? And what's the harm? What could be the motive?
So not so far. And we don't want to see that happen. But we're confident that we have supporters and access to resources to address it should it happen.
Great. Here's a question about what is the long-term hope for increased cash access for families through public benefits? Through the child welfare system, through more private funding, or a separate guaranteed income program?
Is that for advocates, I
Mhm.
guess?
I'm pretty sure this is an advocate question.
Yeah, so I talked about the child tax credit. I mentioned the earned income tax credit. Our efforts are to expand provision of cash assistance through the tax code. And there's like a national movement to do that. As I said, tax benefits have a legitimacy and, a respectability. There's also some issues with regard to addressing potential negative impacts on people's existing safety net benefits. So that's where our efforts are being channeled. So for example, we might take the earned income tax credit for families that don't have children at all, or children eligible for the child tax credit. And we might expand the earned income tax credit, which is very popular across bipartisan lines and has been around, I think, for many decades. We are not at this point taking, a position on TANF cash welfare. I think, the racialized nature of how that's, it's given out to families, and the administrative burdens of it are well known. But we don't advocate using the child welfare system and agencies to provide cash benefits. I think it's rather odd to expect an agency that engages in such punitive practices to also provide people with services and cash. So our position is that that would not be the long-term solution. Our position is that the money that is currently used to fund that program should be channeled outside that agency through whether it's our local human services or Social Security administration at the national level, but not through a system that has the ability to permanently take a parent's child away from them.
Well, I have two follow-up questions that are, again, more specific to your program and a little bit more about the research. So one is, someone wants to know a little bit about how MON provides guaranteed income with no strings, but does it offer anything else like housing counseling, voc ed training, et cetera?
So we actually have, I think, two sets of attorneys in the room who, as a part of the recruitment and enrollment process, provided benefits counseling. That is the ethical thing to do when people are increasing their income and they're already receiving public benefits, to advise them of any potential negative impact. So benefits counseling or benefits cliff counseling, that is what we're doing. We also make them, give them access to our tax credit clinic. We have a wonderful sponsor and attorney in the room who gives advice in that regard. So we are actively encouraging and doing awareness raising to ensure that people are filing, for example, their income taxes, people who have never, ever filed income taxes and are therefore leaving money on the table that they're entitled to. We've recently begun an effort to recruit, to hire a part-time trauma-informed parents defense-oriented social worker to help us facilitate support groups, because that's what the moms have been asking us for. And we have an Moms Empower program, which is run by Samia Warsame, a staff person in the room, which, we essentially try to give the moms on demand what they're asking for. So those are some of the programming. And also, again, our in-house counsel. We've got a staff attorney, Spencer Detweiler, here. Whatever we can do to provide them with support, we provide it.
Great. So are you including trans and gender expansive non-binary parents who may not identify as mothers in your program?
So this is a question we've talked about a lot. The criteria are that they are Black people who have actually given birth. So we intentionally, and I believe we talked about who identify as mothers, but we focus specifically on those who have given birth to children. And in that way, I think we're addressing transgender and being inclusive.
And then for our researchers, how many mothers are enrolled in the intervention and research compensation groups, and how often are follow-ups conducted?
Great question. So as Jim mentioned, this is a pre-pilot, so it's a small group of women. The mothers are, I think, a total of 19, and it's a pretty even split between the direct cash transfer group and the compensated research group. I believe it might be 11 and 9. And was there a follow-up question?
How often are the follow-up
Oh, yes.
interviews conducted?
So the enrollment survey and interview is conducted at the beginning, and then they have 2 additional follow-up interviews and surveys that are conducted about 6 weeks in between each one.
Great. There are a lot of questions, and I keep them coming. I'm just trying to shuffle them into a narrative, which I'm not doing very well at right now because they're all over the place in a good way. But I do actually sat at the table with somebody who's on the community advisory board, and there is a question about, can you talk a little bit more about the community advisory board and their role, what they do?
Yes, so Linda Brown and Akuya Dankwa are here. They're fabulous women. I'd love for them to stand if they could. So they're two of the three moms, who are part of our community advisory board, and we've been working with them continuously for about 2 years. They advised our soft pilot. As Jim mentioned, they were the ones who came up with the great terms that we're using. We also had, some people on the call might know, Angela Burton was a sort of silent kind of professional attorney who advised us in the creation of the Community Advisory Board. So what these women did was we met on Zoom monthly, and they talked about what would be effective and and sensitive ways, for example, to refer to the two groups of moms who are in our pilot. They met with Jim a couple of times, Jim and Mandy, and answered questions and asked lots of questions, if I remember, and were just very key and critical to the design of the pilot. You all elicited lots of information from Jim. You talked about categories of information that we should be inquiring about. And so they were very instrumental in the creation of the pilot program. They have been made themselves available for both pilots that we've created, and they, I think, are waiting to be called upon for any future pilots we might create as well. Are there any other questions you'd
Well,
like me
I'm
to
just,
fine tune?
I'm wondering from Jim or Mandy, is this a usual way of doing research? Is this something that you think is helpful? Is it like slow down your research? What is your feelings about community advisory boards?
They are definitely recommended. It is something that we incorporate into many, and I'd say most of our randomized control trials. Jim, would you like to speak more about the community advisory boards?
This is the best way to do it. I mean, it's just as simple as that. This is the best way. We learn a ton. I've already learned a ton from the Community Advisory Board. And this is what we, as Mandy mentioned, we aspire to do in all of our research. There are some instances in which some combination of timing and severe funding shortages prevent us from following this route. Luckily, this was not one of those instances, nor would this have been among the top, 80% that I would have hoped could be where you would have been able to dispense with. In other words, it's just completely indispensable in this setting. There are multiple reasons, race, class, gender, et cetera, in which this is essential. And in addition, it's just good research practice. And so again, we've learned a ton already. We aspire to do this every time. Sometimes we can't, but this is one where we were able to do it, and it's been extraordinarily powerful.
I'm just wondering if you could give us like an example of something you might have learned from.
Absolutely. So I will never forget one of the very first in my advisory board meetings that I attended, felt extraordinarily welcome. And listening to one of the moms, and with apologies, I will not be able to remember who it was precisely, but listening to one of the moms talking about how debilitating the feeling of surveillance was, and how one of the things that one hoped to be that this particular mom hoped to be able to do with the cash that MON was providing was to avoid the surveillance because, and the quote was, "You're in my underwear." And being in my underwear meant that I could not make choices the way that I should be making choices. And I understand, again, as a researcher, I understand that there may be reasons that one could assert for the surveillance. And so as a researcher, I don't want to take a position one way or the other. I just simply want to say that there were negative aspects of the monitoring that agencies and governments often do of a variety of populations in the criminal justice system and the child welfare system that have negative aspects that may not be 100% fully appreciated. And that was a forceful education in those negative aspects.
Oh, thanks for that example. Either one of you have one you want to share?
So the terms, we just could not use, what is it, control group and treatment group. The Community Advisory Board was just having none of that. They thought it would be demeaning to talk about members of our community in that way. And so we had a very long, I think it was 2 or 3 session conversation. I think Allegra Hayden, who may still be in the room, was with us on staff at that time until we really got the terminology right. And so Compensated Research Group and Direct Cash Transfer Group are the names that these women, smart women, came up with. So those terms, I think themselves are a powerful testament to them insisting on speaking about people in a way that is respectful and dignified.
Thank you, Melody. I think this is going off of where Jim was taking us around surveillance, but someone asks, can you speak to the role of primary prevention for CFS, or maybe it's CPS, intervention, specifically mandatory reporting? How are you engaging with healthcare providers and school systems who act as the primary agents of harm, initiating investigations?
So we are a tiny organization. We want to do more. And that I would say that's, a part of our strategic plan. We did a great deal of outreach to the community to advise them of this pilot, and we are very much interested. I would say that's on our agenda. We've partnered with other organizations to try to move into this field of speaking with mandatory reporters, sharing harms, trying to educate them. So it's just a matter of time, I think, that before we can expand our work and actually engage in that way.
And I'll add
Esther,
that.
yeah, go ahead, Mandy. I think you were going to say the same thing. Go ahead.
So one of my colleagues, Renee Danzer, is working on another randomized control trial that's actually looking in this area. She's working with both North Carolina, and they're looking at a site in Kansas where they will be partnering with a medical legal provider that will have an alternative outlet to mandatory reporting where there is not, like, they're marginalized cases where it's not a mandatory reporting situation, but it allows them to defer to another organization to assist without having that, initiated investigation. And in that way, we're going to be analyzing that program to see its impact. Was that what you were going to say, Jim?
It is. It's just one quick correction. It's South Carolina. It's the program is called CHAMPS, and it is associated with the university. It's a clinic within the University of South Carolina Law School, but everything else absolutely. And it is again designed to assess whether an alternative for a mandated reporter. The background would be useful in this setting, again, along a variety of dimensions. So background statistic here is that in almost every jurisdiction in the country, somewhere between, we'll put it somewhere north of 2/3, typically around 3/4 of referrals to child welfare agencies result in a finding of no action. In other words, the report was simply not something that the agency wants to take action on, and the agency, in fact, did nothing other than investigate. Of course, the alternative word for investigation, which is the researcher we don't immediately go to, is surveil, but investigate. And so the suggestion is that there is over-reporting, at least vis-a-vis the resources that the agency wants to deploy as a result of the report. And so this is the another major initiative research program currently ongoing, currently randomizing cases in South Carolina. We are awaiting a funding decision to expand the research to Kansas.
Well, Jim and Mandy, you're taking us a little bit where this next question is, which is, if we're not in DC, how can we start a program like this in our state?
You have to find some generous support, philanthropic supporters who are really willing to invest in an independent program, an independent, privately operated, external to the government program. I think that's vitally important. And we're happy to talk with you. I mean, we would love to see more programs like this around the country. And so, yeah, so I'd be happy to speak with whoever is interested. Great.
I'll add too, as a researcher, it's great to get research involved at the beginning, especially randomized control trials can help you generate that rigorous evidence that you could then, build upon and seek additional funding.
So I have several questions here about child welfare. And one is anticipating positive effects of the pilot and thinking long-term about connecting guaranteed income through the tax code. Are you thinking about ways to continue to spotlight families who are impacted by the child welfare system?
Absolutely. So we're focused not only on cash assistance and addressing poverty in that way, but on this system itself and its harmful impact. I spoke several times about the lack of access to counsel. There is, just as Jim alluded to, there are these parallels with the criminal legal system, but there are some operations and procedures that are just unparalleled in this system. There is a shocking lack of due process that parents essentially through an investigation has, one person who is making a decision or a couple of people with regard to a parent potentially just losing their child, the child being snatched away, and there is no right to counsel. And these are administrative agencies making these decisions. And we are working very hard locally to try to get champions for this work. And we think we might have one, but that is of important focus. So while we focus on cash assistance and addressing poverty, we're also focused on this system itself and the harms that it perpetrates against for Black and marginalized families in Washington, D.C.
And Melody, is your optional programming available to those not in the pilot? And how do you approach your peer support model?
Absolutely. It's available to those in the program. We do have some budget constraints around some of our stipended programs, but we do conduct outreach in the broader community. So you don't have to be involved in the pilot to access the programming. But we absolutely offer it to moms across the board, whether they're in the research group or the direct cash transfer group. Our peer support model is really determined by the moms in the group, and it has been evolving. One of the really exciting pieces of this is that moms, as they individually develop, their interests and skills, are bringing them back to the group. So we've had Linda, for example, is in the audience, provide a peer-supported wellness session. And we're really looking forward to more of those activities. And we have, as I said earlier, something like an on-demand program. We've had people come into our twice monthly meetings on Zoom and increasingly now in person to talk about forming a cooperative business. We've had a spokesperson from the Ombudsperson for Child and Family Services Agency come in and talk to us. So we also use this opportunity to spotlight our DC Guaranteed Income Coalition activities and encourage and educate the moms around our policy advocacy, which we're very proud of. So it's political policy education, it's wellness and peer support, and moms are pushing us to do even more all the time.
Great. We're coming to the end. So I want to give Jim, Mandy, and Melody an opportunity just to leave the room, both virtual and real room here, with one last thought, like what's sitting with you, given all the questions you've heard from the audience. I mean, I just want to thank everybody for your questions. We couldn't get to them all. I tried to group them as best we can, but all the questions are being saved and again, being used to inform future programming. So again, one final thought from each of you.
So, I mean, I'll just say that, there's been discussion about providing cash payments as a diversion for families who are screened out of the system. I'm very concerned about the increasing role of these child welfare agencies, for example, in the lives of people who, if they're screened out, have not met any criteria for being involved with the agency. So I'm just really worried about that. And I'm also worried about increasing use of these agencies to address a broad variety of issues that families have. They really shouldn't have to get involved with, a system that is essentially carceral and can permanently snatch their children away from them. So I just want to make sure people focus on those policies.
I'll just say that there are a lot of theories and a lot of assumptions, but not enough evidence. And so getting research involved in programs like these helps develop that evidence that shows the impact of these programs.
And just to add with that final thought, two aspects of the research here that I think represent best practices. One is the use of randomization. This is something that the legal system has been far, far behind every other field, not just medicine, its traditional professional counterpart, but every other social science field, education, economics, psychology, just any field that you name has embraced the use of credible evidence generating research projects, and credible evidence generating research projects are viewed with amusement at best, as sustained and contempt and laughter more likely in the legal field more generally. And then second, it will not do to limit ourselves to randomization. Again, the involvement of the Community Advisory Board on the qualitative research programs have been absolutely essential. And so for folks thinking about research and funding research in this area, it is not enough to know that A is greater than B. Whatever A is, whatever B is, on any dimension, greater on whatever dimension you pick out. You need to know why, or else you can't generalize and use the findings in the future. And that is where the involvement, again, of the research partner, the Community Advisory Board, and qualitative information comes in so strongly. And so it's just an absolute joy to be able to do one well, the way we're doing one here.
Thank you all so much. I hope that many of your questions were answered in this very quick presentation, panel discussion, I should say. But now I am so pleased to invite up Yasmine Holmes for reflections on the Mother Up Guaranteed Income Pilot. Yasmine is a peer advocacy fellow with Mothers Outreach Network and a pilot participant in Mother Outreach Network's first cohort. Welcome.
Thank you. Good afternoon, everyone. My name is Yasmine Holmes, and I'm a single mother with 4 sons, all under the age of 5 years old. I was born in DC and grew up in the foster care system. I am currently a participant in the Mothers Up Guaranteed Income Program, and I would like to share my story with you all on how the Mother Up program and Mothers Outreach Network has made a huge difference in my life. When my kids were younger, I used to work at a grocery store, but with jobs like that, you don't get a set schedule. Some days you work early and some days you stay late. And the daycare facility complained that I wasn't picking my kids up on time, so I had to stop. The job took a toll on my body and on my mind, and I could not do it anymore. I left that job and now care for my kids full time. I can tell you firsthand that taking care of kids is work. I don't have that family support where I can just have my mom or dad help me out with my kids. Every single part of taking care of my kids is my responsibility. On top of that, my children and I have been staying in an apartment in a building and neighborhood that wasn't safe for them. In April of 2023, I was able to join the Mothers Up Guaranteed Income Pilot Program, and I now receive $500 per month for 3 years. Because of this program, I was able to move into a house for a few months Before Mothers Up, my caseworker was worried about me getting the house because I was only getting one income through my benefits. But when I told her about the program, that's when I got approved for the house because she saw that I had that extra income. My kids love this house. They're always playing around and exploring, and I love seeing them have fun. The Mothers Up Guaranteed Income program was not only a source of financial support, but it also opened up many opportunities to engage in advocacy and the dedication to Black mothers and their wellness. As a member of the Mothers Outreach Network, I've had the ability to speak on a panel to members of Congress on Capitol Hill with other moms about creating a new tax credit law. I was also able to share my experiences with members of the DC Council to vote my support for the district child tax credit, which was ultimately passed thanks to the hard work of the moms that spoke out, and share my story at Advocacy Day event at the Wilson Building in September. To encourage the DC Council to expand the district child tax credit eligible critics so that more mothers can receive the benefits. I also am part of the Mothers Outreach Network program, Moms Empower. This is a support group for moms where we can share resources, receive information that educate us on our rights if we are being investigated by CPS. We also participate in workshops that teach us how to claim tax credit. Most importantly, Moms Empire creates a supportive community for mothers who are facing challenges. I want to give a huge thank you to the executive director, Ms. Melanie Webb,
No.
for all the hard work and the time she dedicates to helping us moms. Thank you. I'm glad to see everyone here.
That was amazing, wasn't it? Good afternoon, everyone. My name is Shelley English Figaro, and I sit on the Board of Directors of Mothers Outreach Network. I'm also the co-host for this event, along with my partner in crime, Kathy Krebs. Give her a wave, give her a hand. She's manning the Zoom, collecting questions. Thank you so much. First of all, let's hear it for our fabulous panel. Outstanding. I'd also like to acknowledge some of the moms from Mothers Outreach Network who were here. I'm not sure if they're still here, but they were here listening to the event. But most of all, I'd like to give a special thank you to Yasmine. Can we give her another round of applause? Yasmine, you really inspire us, your resilience, your determination, your strength in advocating for yourself and for other mothers like yourself, because you are determined to give your children the bright future that they deserve. So again, thank you for being here. Thank you for speaking to us. Thank you for everything you're doing. So today is a very important day for Mothers Outreach Network. And we are so grateful that you're here, taking the time to be with us today. We have more work to do. And in order to do that, we need your help. We need help with the legal work, the educational work, the research, the advocacy, and the direct service, so we can preserve Black families like Yasmine's. So in order to do that, we need dollars. We need your financial support. So you know what time it is. This is why I'm here. They brought me up because I'm the money person. And so I'm the treasurer of the board. And so I am here to ask your financial assistance. On your table and on the screen right now, I can't see it, but hopefully on the screen right now for our Zoom participants, you will see information as to how to donate to our cause. Take out your phones, please. I invite you to take out your phones and text the word Mother Up to 44321. That information is on the cards on your table along with the QR codes. We need your support. please make a contribution because we can't do this work without you. Please invite others to align with our mission. And please, we want you to do the same because we need your support. Black families need your support. So thank you again for being here with us today. We know you could have been anywhere else. And let's keep the conversation going. So thank you. So without any further ado, I would like to invite our fearless leader, Melody Webb, to close us out.
Thank you so much, Shelley. Okay, so there are so many people to thank, and I do want to thank all of you for spending your morning, afternoon with us. We're just so grateful. Thank you very, very much. I want to thank our research partners and our moderators. I don't know if Jim's still on the line, but I want to thank you, Mandy and Alina, who's an indispensable part of the team, the research team. I want y'all to join me in giving them some applause. Thank you so much. I also want to thank Kristen Weber, our moderator, who agreed to do this in such short time, with such short notice. And Kathy again for being instrumental in bringing her to us. I want to thank those who have traveled from wherever, if it's across town, and some I believe have traveled from New York. So we're so grateful. I want to thank the 150 plus registrants. Maybe not all of them showed up, but we're so excited about the interest. We want to also, that's the registrants for the Zoom. And we hope that people will follow us at Mothers Outreach on our social media outlets. I also want to, so thank you all. I want to also now pause and thank our co-chairs, Shelley English Figaro and Kathy Krebs. Would you all please stand here? So they shepherded this event through endless like Zoom meetings at 8 at night and on weekends, and they were just amazing champions for that purpose. And I also want to thank our board chair, Esther, who took her entire day, Esther Coleman, let's give her applause, for taking the entire day to devote to us. I have others I want to thank. So David Fisher, who is the person I kept alluding to as the pro bono lawyer who helped us build this really exciting, first on Zoom, tax credit clinic for parents. It's a brief advice clinic that is not only giving people advice, but it's raising awareness. Like 1 out of 4 families eligible for the earned income tax credit don't claim it. So we started this project and a lot of people have been excited about it. And that was what, 3 years ago, right, David? So David, will you please stand so we can, thank you so much. And we thank Evershed Sutherland for being our sponsor, Harmony, and also colleagues. If you always just want to give them some applause as well. Harmony Jones. We want to thank our in-kind donor, I think Murray Shield, he had to leave. I just want to tell you all, he single-handedly gave benefits, I like to call it benefits cliff advice, but it's benefits counseling to every single mother in our phase 2 guaranteed income pilot. I kept saying, Murray, can we give you a little bit of something? And he just declined. So he devoted, I mean, that's 20 moms. So I just want to thank in his absence, Murray, for all that he's done. And then we also have our partners from Whitman Walker Legal Services. So Amy, we're just so excited that Whitman Walker Legal Services advised our initial pilot, our soft launch pilot, single-handedly did that. They also advised this other summertime pilot that we held this past summer. And this program, I can't say enough that legal service is a really big part of both giving support to moms that come to us and also a part of ensuring that they don't lose any benefits or that they're advised of the possibility and can take steps to address it. if they're at risk of losing them. So thank you so much, Amy and Whitman Walker Legal Services. Okay. I also want to thank the Public Welfare Foundation and the True Reformer Building for this beautiful space that's been provided to us completely free of charge. We appreciate that as a small organization, a small nonprofit. I want to acknowledge two people who were instrumental in our pilot program and no longer working on them, but I want to ask Diane Lewis, if she's still here, to please stand. Diane has been like just an amazing informational resource. She's the person I've gone to when I was frustrated, which was more than many times. And she's been a calm and steady presence in that regard. So I want to just thank Diane. Allegra Hayden was there from the beginning. I think she may have left as well, where we really had a lot of building to do. And I want to pause and really thank the staff as well, because in her place is Samia Warsame. I don't know where Samia is. She's just an all-purpose. I'm gonna stand up. I mean, Samia really helped us get the moms into the program. Allegra did so much of the groundwork, and then she got 20 women to this project. Not a small feat. I want to thank Emily, also Emily Harmon, who's in the room, and she's just been an assistant and helpful in many different ways. Spencer is brand new, but Spencer is learning to do what Murray has done and providing benefits counseling to our upcoming pilot. And I'm almost done here, but I do want to acknowledge our honorary committee, a member a staff member of which is Nico here at the Office of Council member Christina Henderson. We're really excited about working with the council member. And then finally, I want to thank the mothers. This is not final. Sorry, I misspoke. So there's one more group most important after this. So I want to thank the Board of Mothers Outreach Network. If you all could please stand. So we have every single board member present, if they haven't left already, except for one member. So Esther Coleman, the chair, Kelvin Lassiter, who is also our MC. Sophia Mitchell, who's in the back there, Kathy Krebs, and Shelley English Figaro. So thank you all so much for your stewardship. And then finally, I want to thank the moms who are here. Moms, you guys drive everything, and I see myself as constantly striving for your approval. And I think our programs just aim to integrate and build and lift you up as much as possible. So if y'all will join me in thanking moms who are present, if you guys could stand. And Sharon Harris, I think Sharon is there. And Doreen Booker, thank you guys. I think some of the moms had to leave. And that concludes our program. I think I've thought of everyone in the room, but thank you all so much for being here, and please enjoy. I do want to thank Liz. Where is Liz? Is she out of the room? Liz back there. Liz, thank you so much. Liz Moore, and also Academy of Sounds, Denny, who's back there in the back. We so appreciate you, Denny. I think this went off really well. Let's give him a big round of applause. I don't know how many people joined the webinar, but we at Mothers Outreach, and some of you, our supporters, know this. We have had so many snafus in the past with hybrid events. So I am so impressed, Denny. Thank you so much for broadcasting a hybrid event so flawlessly. We really appreciate you. Okay. Okay, and I think with that, if you all want to hang around and talk a little bit, we would welcome it. And again, thank you so much for coming out.